Hello, and how are you? Welcome to the session on stages of palliative care. My name is Winnie Pagawa. This is a platform where we do lectures, notes, and expert interviews related to healthcare. And this is an area that you really love and you wish to learn more about. Kindly remember to give us a subscribe by clicking on the subscribe button. And you can also click on the notification button so that we can be notified when we post the next lecture. And for now, I'm going to take you through the different stages that a patient goes through during the palliative care stages, from the beginning all the way to the last days of their life at the end of life. So the stages of palliative care are five, starting with the first. So the first stage is stage one, which is stable stage. Stage two is unstable stage. Stage three is known as deteriorating. And then stage four is known as terminal. And the fifth stage is bereavement. So this is like the care journey for our palliative patient, where we start with the first stage where the patient is being diagnosed with the terminal illness. And so the plan for palliative care starts. And then as we go on, there's progress on the illness and management, and it gets worse. And so we end up adjusting the care plan and preparing our patient emotionally on the possible progress that can come along as we keep on managing him or her. And stage three is whereby the status deteriorates and we have to shift to the end of life care. And on stage four, it's the terminal stage. And at this time, we are only focusing more on symptom management, emotional and spiritual care as we prepare our patient for the last stage, which is bereavement. And at this stage, different patients might prefer different approaches, but many of them will prefer support of the family, their loved one, and the carers at that time. Known as stable. So at this stage, this is where palliative care can start, and this is the stage where the patient has been confirmed and there's a prognosis of a life-threatening illness. So at this case, the team looks into how do we get our patient catered for holistically by focusing more on how do we work on our treatment plan, how do we look at the evolution of the disease or the illness, which drugs and medications are very important at this time, looking into symptom relief, and any care preferences that the individual might prefer. Remember, at this stage, the patient is the first time we are actually informing them of the palliative care, that the illness is not progressing well, the management is not coming out as effective as we wished, and so you will want to start off our patient at the palliative care stage, the palliative care management. So at this level, you really need to sit down, discuss current and future treatment plans, the possible changes that can come along with the disease, the essential medication that are key and important at that particular time, and the symptoms that are priority to the client. And then you can ask the client preferences, like how do they wish to be handled? Do they want to be treated from home, or will they prefer to be treated in an institution? So you discuss, and then you can talk about which management they feel should be continued or they feel should be discontinued. These are also areas you can sit down, avail the possible options, and then the ones that they wish to keep on or eliminate, you can agree together on that. And the second stage is stage two, known as unstable. So at this stage, the individual illness is displaying a worsening symptom. It's getting worse than what we know. And so the team has to sit down and adjust the care plan and the management, working more towards emotional and the psychological support. Reason being, the disease is not getting better, the patient is not improving as maybe planned, or the treatment is not responding as we had projected or thought it might. So in this case, there's more on providing a safe space where the client can discuss their emotions either with a qualified counselor or with a therapist or be it a psychologist. We can also bring in a spiritual leader here to guide our client and take them through what they believe and stand for. And stage three, deteriorating. So here, the condition is worse or gradually becoming worse. And there's a shift now to looking into the end of life care, where we can prepare our patient for the worst. And in this case, where the medical condition is becoming severe, then you can look at medical treatment that are no longer needed and we can eliminate, We can also focus more on the symptom relief and management. So in case the pain is also becoming worse, you can strengthen the pain management by moving up the ladder or looking into the simple rules that you can apply to adjust the pain management. And then in this case, also at stage 3, it said that some people have maybe only weeks or months till their last days. And so you want to encourage more with the family members. You want them to be close to their families. And you can boost more of the emotional, psychosocial, and spiritual support. So remember, we had initiated emotional and psychosocial and spiritual support in stage 2. So in this stage, you will boost it more or you will intensify the support that comes at this stage. In the stage 4, here is where we talk about the terminal stage. The terminal stage is majorly focusing on symptoms, emotional and spiritual care. So the patient is nearing the end of their life, may only have a few days left. So this comprises of extensive physical and medical care within the comfort of their home or a hospital family setting, but in the presence of their loved one. Remember, it is last moments, and most patients prefer to be in the presence of their loved ones. Very few will prefer to be in solitude, but majority will prefer their family members to be present. So you can forge forward that proposal to them and hear if they can call them closer home. So individuals may experience the following symptoms at this stage. They may be becoming bedridden, so they'll be on total care in terms of activities of daily living. They are experiencing severe mobility issues and constraint. They're not able to move, they're not able to turn on their own, so they're in the total help of a caregiver or a carer. There's also a decrease or total loss of appetite. There's difficulty of swallowing more so solid foods and also solid medication. And a severe diagnosis that requires daily medical intervention because they're totally shutting down or they're breaking down and the disease has no hope of turning at all or turning positive or becoming better. And lastly, we have stage 5, which is bereavement. So at the bereavement stage, main focus is on family members, loved one, and the carers. So at this level, we are saying the individual with the life-limiting illness has passed on, and there's now more provision of bereavement care and services. So, for example, one of the care services you can give for bereaved families is emotional support by taking them through maybe a specific support group. There's also giving spiritual support, that is, if appropriately, through a religious leader or faith leaders. And then the other bit is on psychosocial support to help them with grief, losses, and adjustment after a loved one's death. Remember, not every person is able to afford insurance services, and so some may have exhausted all their financial options or they have exhausted financial abilities, and so at this time, maybe they are frustrated, they are trying to pick up. So there's a lot of need to just help them pick up emotionally, spiritually, and also psychologically. So bringing in a counselor, bringing in a support group, or a religious leader to just help through will actually be a very good idea at this stage. And so that marks the end of the 5 stages of palliative care, where we were taking ourselves through the first time when the patient has been prescribed palliative care to the last moment when the patient passes on, and what can happen in terms of management in all these stages. So if this is something you enjoy and you want to learn more with us, kindly remember to subscribe, share, and also like our videos. Thank you so much and see you in our next class.